Hi YouTube, I'm coming on to make my first, I guess, pregnancy vlog. Um, I just want to explain exactly what happened because I know my last video in March was for the contest, and really um, a lot has changed. So, backtracking to March, so I got sick with pneumonia. Number one, at the beginning of March, I went on antibiotics. After I went on the antibiotics, I had a fertility clinic appointment. I'm trying to look at my phone. Had a fertility clinic appointment March. Oh, come on. That's really May. Oh, March 13th. It went great. My doctor told me pretty much you're going to get pregnant. All we need to do is get sperm to your egg and you're done. And the best way to do that is IUI. And so I figured, okay, let's just do IUI, get it over with. Well, with what money? And then I asked her too, what about IVF? And she said, that's fine. We could do IVF too. If you want us to get straight to IVF, she's up for it. She sent me out for blood work, sent me out for, with a packet of information about different ways to pay and blah, blah, blah. And so, I think I've already addressed this. I have 2 jobs now. I'm a preschool teacher. So I'm just like, let me just work for the next 6 months, save up, and then we'll do this. But then, at the end of March, I started feeling better. And it was my birthday. My birthday's at the beginning of April. So I was like, oh my goodness, this is the perfect time. Let's do a Femara cycle. Huh. End of March, I took Femara. Well, let's see. End of March, I took Femara. And I swear the first day I took my Femara pill, which was March. I'm a fertility friend. Sorry. This is March. Ooh. 25th. Okay. Yeah. Yeah, it's like CD11. Anyway, I took it March 25th. I swear I was ovulating. It was, and I was temping too. So I had my temperature. I was temping as well. So that showed that I had ovulated. The first day I took my Femara pills, and I was taking 7.5 milligrams for 5 days. So I took it from the 25th until the 31st. 1, 2, 3. Yeah. 1, 2, 3, 4. Yeah, from the 25th to the 29th. And so I ovulated the first day I took Femara. And the reason why I know I ovulated is because on April 9th, AF came. So AF came for me. Oh my goodness, I should be more organized for this. 2 weeks after I took my Femara pills, so I was done. I said, this is it. I throw up my hands. I have to give this to God. I have to give this to higher power. If you don't believe in God, I just say higher power. I have to give this away because obviously it's just not going to happen. So, April 22nd, I decide, oh my goodness, not I decide, I was at work. And all of a sudden, I felt some twinges in my right side. And I said, oh, wow. This feels a lot like when I take my fertility drug. So let me go ahead and take an OPK because I bought OPKs for my Femara cycle thinking I wouldn't ovulate until the 17th of it. It was a mess. So anyway, so I took my second ovulation test April 22nd and a blazing positive. Well, that's not the end of it. I took my OPKs April 22nd, April 23rd, April 24th, April 25th, and April 26th. Blazing positives. I just stopped testing after the 25th. I don't know when they went negative, but I know that on April 27th, I had a negative home pregnancy test. So I was like, okay, I'm not pregnant from the Femara. I'm absolutely not pregnant from the Femara. Something's not right. So, let's see, on Saturday, the 2nd, all of a sudden I had these cramps. This is when it gets interesting, okay? So I had these cramps, and they were shooting horizontally from my right side to my left. So it was going from where I feel like my right ovary is to my left ovary. So I'm like, oh my gosh, Sunday, the 3rd, I could not walk. I couldn't walk. I was like, this is the weirdest thing ever. So what's going on? I had to call off work on Monday. I still couldn't walk. And I just was like, this feels different. I'm having these pains. And thinking back on it, like, certain smells were really getting to me. Like, I just, like the smell of my air freshener. It's like summertime breeze. And I'm just like, ooh, oh God. Not throwing up, but just like, ugh, this stinks. And so, Monday I didn't go to work. So Tuesday morning, after I had my big presentation with my class, because school's almost finished, at my presentation, I was just like, I feel weird. Monday night after I left class, I had to go get Burger King. So I went to Burger King, I got the food, and I ate it, and it was like I'd never eaten anything in my life, and I'm like, oh crap. And the cramping was just bad. Like, the cramping felt like hammering in my uterus, hammering in my ovaries and my side. And so I was just like, if I don't feel better in the morning, I'll just take some Tylenol and go to work, because, I can't miss work. Well, I woke up Tuesday morning, the 5th, and I was just like, okay, I have one pregnancy test left that I bought and took on the 26th. I bought a 2-pack of FRERs, first response, early response, but they're the rapid test. And so it's just like, okay, if this is positive, I know why. If it's negative, what's new? Well, I took the FRER rapid response, and it's in 1 minute. And within a minute, I'll show you. And this is my first HPT. Within 1 minute, oh, come on. Bam. Can you see that? Talk about rapid, and I was just floored. So, I couldn't believe it. I'm pregnant. I'm really, really pregnant. I was just like, I had to text my sister. I sent pictures. I sent pictures to the dad. I sent pictures to all my friends. I'm like, oh my God, because it's June of this year would have marked 5 years of trying to conceive. 5. 1, 2, 3, 4, 5. So I'm like, it's May of 2015. So you mean I didn't even make it to the 5-year mark? Oh my God. And so, I couldn't believe it. I called off work again and went to a free clinic where they mostly do abortions. And I've been there so many times just over the years for different testing and stuff like that. It's like my go-to place instead of going to OBGYN because, I didn't have insurance back then. Now I have insurance now, but I just like the place. So I went there, and I was like, well, I think it's finally happened because, they know about the PCOS. So I think it's finally happened. So she's like, okay, we'll take the test, and if it's negative, we'll just send you out for a blood test. Fine, they've done that before. We sat there, took the test, she dipped the stick, and she's like, oh my God, it's positive. Gave me my paperwork as a pregnancy verification form, gave it to me, and was like, congratulations, are you going to keep it? Yeah. So, we just ask that you follow up with your obstetrician. I was like, obstetrician? Okay, now back to the cramping, though. It's still going horizontally from the right lower abdomen to the left. So I was like, oh no. And I was like, can you guys do blood work? Can you guys do ultrasounds? No, they couldn't. This is a free clinic. So I was like, okay, I have to go to the ER. Big mistake. So I get to the ER around 2 or 3 after I ate. Because I'm hungry. I was hungry. So I went to the ER after I ate. And sat there. They tried to give me an ultrasound. But my bladder wasn't full. So, they had me drink like 2 huge cups of water. And then they took me back again for the ultrasounds, transvaginal and pelvic. And then I took blood. And then I urinated in a cup. And waited. Okay. So, by the time I got there at like 2 or 3. By the time I left, it was like 8 o'clock. And pretty much, I'm all clear, STD free. Okay, and my blood test was positive. My HCG level on Tuesday was 70. urine test was positive for pregnancy. Now, my ultrasound came back that there was no intrauterine pregnancy visible. What does the paper say? Because I have my emergency room packet here. It says, I don't get the exact wording, I just like that. It says, oh boy, trans-abdominal and transvaginal examination of the pelvis was performed. Negative for intrauterine gestation. And findings may be secondary to either a missed AB or early ectopic. Recommended follow-up assessment with pelvic ultrasound or serial beta HCG. Okay. Problem number 1, and I didn't know this until I started researching like a maniac. Problem number 1 is on Tuesday. I was about 3 weeks and 3 days pregnant. Possibly 3 weeks, 4 days, possibly 3 weeks, 5 days. I mean, really, about 9 days post ovulation. So, oh goodness, I think that's like 3 weeks and that might be 3 weeks and 3 days. Seriously. So, to have an HCG level at that early of 70, you're pregnant. You cannot see a gestational sac on an ultrasound until your HCG levels are at least 1500. Or you are 6 to 7 or 7 to 8 weeks pregnant. The reason why there's no gestational sac seen because I just got pregnant like last week. So, the nurse had pulled me inside and told me, I'm sorry, you had a miscarriage. And I told her, I'm not bleeding, I'm not spotting. I'm not bleeding or not spotting. I just have very, very bad cramps. And she looked very confused. She didn't know what to say. And I was like, okay, so what happens if my HCG levels increase? Because she told me, no. The paperwork told me to go get another beta done. She said, well, if your levels increase, you're having an ectopic pregnancy. Made no sense. I just told her, okay, that's fine. Thanks. And I left. I signed my release forms and left the ER. So, yesterday, I was able to set up my first obstetrician appointment for tomorrow, and I'll get more information, but pretty much at this point, even though I talked to the medical assistant over the phone this early, there's nothing to be seen, there's really nothing they could do, but because the ER diagnosed me with a threatened abortion, which is medical term for miscarriage, they could see me early. Really nothing they could see via ultrasound until June, maybe middle of June, maybe. And my due date is January 14th of 2016. All my paperwork say that. So I'm due in January. Symptoms, indigestion, heartburn, cramping, and cravings for Burger King. I need Burger King. Oh my gosh, like, I need beef. I need cheeseburgers. Cheeseburgers, yes. Like, give me that. And I'm sleeping a lot more. Like, if I'm not at work, I'm in bed. I'm asleep. I can't even. So, yeah. That's my, this is my, I guess, pregnancy vlog. I don't know if I really want to put it as a vlog, really, seriously, because it's like, I'm not sure if I'm going to keep up with this, but you guys have followed me for so long, I just thought I can't leave them hanging. I have baby clothes. I bought some diapers yesterday, diapers and wipes. I know, early, but whatever. I'm starting a baby registry already. If I miscarry, good Lord, that's just what was meant to happen. I mean, I can't live in fear. I'm not going to. I want to embrace this pregnancy. I feel like this baby's here to stay. And if not, we'll try again. I'm not sure if I'll have a baby shower. What else? Oh, you guys saw this test last night. The pregnant 2 to 3. And see, I don't like this camera. Pregnant 2 to 3. I actually looked at the paper and it said pregnant 2 to 3 is 4 to 5 weeks pregnant, not 5 to 6. So yeah, I'm only 4 to 5 weeks pregnant. Alright, well, that's my video. I seriously don't know when I'll record again, but I just want to let you guys know I'm pregnant. I'm fine. No bleeding, no spotting. Everything seems normal to me. Um, I took a clear blue on Tuesday night, but it's blank now. There's nothing there, so I couldn't show you, but it said 1 to 2. And it already went blank, and I read that, or heard that on clear blue, to get 2 to 3, your HCG has to be over 200. So since I got 2 to 3 last night, obviously my numbers are increasing. I'm fine. So that's my video, 16 minutes long, but I have to tell you guys everything. Like, this was natural. Maybe the Femara was in my system, so I don't know. But I did have a period after taking it. I had a period, yeah, after taking it. And it doesn't have a long half-life, so I didn't ovulate till almost a month after taking it, so I doubt that. What did I do different? Oh my goodness. Okay, this is gonna be a long video, but what I did different, I started 2 jobs. I am on my feet 6 days a week. I'm in school. No metformin, no vitamins, no supplements. Maybe it was a Femara after effects, but honestly, I don't think so. That's not how it's worked in the past. So pretty much this is a natural pregnancy. Surprise, surprise. 5 years, and here it is. This is a miracle. This is a miracle.